Bangladesh.
Hi, everybody. Can you listen me?
Hello, yes. Hello.
This is Aman Blakakar, Chief Executive Officer, Socio Pakistan, and Executive Council Members and CSA Pakistan. Thank you.
Nice to meet you, Amanullah. Andy, are you going to facilitate this group, Andy?
Hi everyone. I think Andrew is on hold.
Hello, Andy. Can you hear Mrs. Nazdin? Hello. Hello.
Hello, everybody. Can everybody hear me? Okay, in Breakout Group 3.
Hello. Anybody hear me? This is Nazni. I just want to sure that you are hearing me.
Yes, Nazdin, we can hear you.
Oh, no.
Yeah. Can everybody hear me? Okay.
Yes, Andy.
Okay, thank you.
Yes, Andy.
Fantastic. Yes. Okay. Really great to have you all in here. So just give me 2 more seconds.
I can hear you.
Fantastic. Give me a couple of more minutes, and what I'll do is I just need to sort out a few people in the lobby, and then I will in the plenary room, and then I'll come back and we can get started as a group. So just give me a couple of more minutes, and I'll be back. Hello, everybody in Breakout Group 3. Hope you're all well. So Andy here. So I think we have pretty much everybody here now. There's just maybe a couple of more people in the lobby, but hopefully that is going okay now. So yeah, we can get started here in Breakout Group 3. So I wonder if, as there is just 11 of us in the team, so what I will do is maybe I'll go around and we can do a quick introduction of ourselves. So I can start, and then we can yes, do a quick intro to ourselves and go from there, and then we can start the presentations. So, hi everybody, I'm Andy Ruck. I'm the Fundraising and Sustainability Advisor for the Sun CSN Secretariat. Yes, and really excited to have you all here today and to discuss the amazing work you've all been doing. So, over to somebody else.
Yes, thank you, Andy. This is Nazneen Rahman from Bangladesh. I'm also co-chair of CSS Sun. Thank you.
Hello, good afternoon. I'm Rosie from Sun CSA Coordinator Indonesia. Nice to meet you all.
Hi everyone, I'm Camille from the IRRR in the Philippines, representing my colleagues from the Sun CSA Philippines.
Assalamu alaikum. This is Amanullah Kakar, Chief Executive Officer, Socio Pakistan and Executive Council Member, Sun CSA Pakistan.
Alaikum salam.
Hi everyone, I am Swali, representing.
Hello everybody. Good afternoon from Vietnam. We are 4 people from Alliance Tribe, Save the Children, and Hellbridge from the Sun CSA Vietnam. Hello.
Bùi Hưng, Save the Children,
Hello.
Sun CSA Vietnam. Thank you.
Hello everyone, my name is Nguyen from FIDR and Sun CSA Vietnam. Nice to meet all of you.
Hello. Hello everyone, my name is Dr. is from Sun CSA Cambodia. And I'm here with 2 people. My name is Kim Sro from Sun CSA Cambodia.
Hello everyone, I am Sandamali from Sri Lanka, Executive Council member of Sun CSA in Sri Lanka.
Fantastic. I think maybe that is most people. Let me double check. I think most people have spoken now. Yeah. So if you haven't, do just give us a shout, and then we can go from there. So yes, today's little mini breakout group that we have today. What we will do is we'll go through the 3 CSAs we'll be presenting. That will be Indonesia, Nepal, and Vietnam. And what we will do from there is do a quick 5-minute presentation, 5 to 10-minute presentation from each CSA, and then we can have a couple of minutes questions after each if there's any questions. And then what we can do is have bring back to a discussion at the end before we join back in the plenary. Is anybody happy to present back to the wider plenary group of what we discussed today? If not, I'm very happy to do that myself. But yeah, so what I'll do is, if anybody's happy, please do just put in the chat box that you're happy to share what we've discussed here in this session in the chat box that you're happy to do that, and we can get you to do that. If not, I'm very happy to do it as well. So I guess what we can do is we can start. So Indonesia, Rosie, I think this might be you presenting. Are you able to share your screen, or would you like me to share the screen for you?
Let me try to share. If I have problem, please help. Okay,
Perfect,
I try to share. Is it coming?
Not yet. It's still yeah, not shared.
Moment, please. Let me try again.
Sometimes Microsoft Teams can be a little bit blocky in terms of getting stuff done. But if you go on the more actions, there's near the microphone where you can mute yourself. There should be like the share.
Is it
content.
coming, Andy? Not yet.
No, it's still not showing.
Moment, please. Or if you can help me, Andy, do you have the PPT with you?
Yeah, I've got it here. So what I can do is I'll share my screen, and then what I'll do is you can just tell me when to jump to the next slide.
Okay.
So what I'll do is I'll share my screen now. So hopefully you can all see my screen. Let me know if you can't. Okay, can you see my screen okay?
Yes.
Yes. Yes.
Fantastic. Okay, so I've put it full screen. So Rosie, over to you. Just let me know when you want me to go to the next slide.
Okay. Thank you, everyone. Thank you, Henry. First of all, I would like to introduce Sun CSA Indonesia. We are from Nutrition International that over for the last 2 years has been appointed as Sun CSA coordinator in Indonesia. In this group, we have some other colleagues joining this group. So next slide, please, Andy. Yeah, Sun CSA Indonesia is formed in 2019, but this just formally launched in 2020 in April. Because of situation, COVID situation, we just do the virtual launching in April 2020. By 2020, we have 95 members. Our organization is hosted. We have a steering committee, national sub-national group. We also have a membership. We have a work plan, but not yet in place. Shared to other members in the country. Next slide, please, Andy. Okay. Key changes in 2020. As I mentioned that in April 2020, the CSA network has formally reactivated and virtually launched. This already have its governance, the steering committee, also the membership at national and sub-national level. Sun CSA coordinator lead the change of standard wheat flour fortification in Indonesia, because previously the government apply wheat flour fortification using less bioavailable iron. We, together with other colleagues in CSO Indonesia, advocate the government to change the standard. Now the standard is already following the WHO standard. It is very important to have a good iron fortificant in the fortified wheat to reduce anemia in Indonesia. Other significant change is now the Sun CSA Indonesia already functioning. We have a steering committee, we have a regular meeting at national level, and we just expanded member to subnational. In Indonesia, we have 3 layers of administration. First is the central level, second is province level, and the third is district level. Now we are trying to expand our membership into district level. The other significant achievement is about food fortification. This is a scalable intervention that ensure all majority of the population is provided with the essential micronutrients like iron, folic acid, zinc, which is a life-saving information before, during, and after this COVID pandemics. Next slide, please, Andy. The role of Sun CSA is mostly advocacy. We, as a Sun CSA coordinator, organize meeting of Sun CSA general body and executing steering committee. We conduct meetings, workshop, webinars for membership expansion in at least now 2 provinces in Central Java and East Java province. We organize coordination meeting with other Sun network platform at national level. For instance, coordination with the Sun Business Network, coordination with the government platform, and also donor platform. Sun CSA also advocate government Indonesia in creating, maintaining, and enabling environment. We provide technical assistance to Ministry of Industry to revise the standard of food fortification. We organize expert meetings, doing organoleptic study, and also conduct national workshop on food fortification. Then we have successfully developed a new protocol to identify iron use in fortified wheat in Indonesia. Next slide, Andy. So this is the pictures of the Sun CSA Indonesia. Their role is the steering committee consists of about 6 CSO. Some of them is international CSO. You might already knew, like Save the Children, Helen Keller, also SNV Netherlands. It is an international CSO that as a member of steering committee. What is the role of CSO is mostly on, there are many members, religion-based members. There are also early childhood care education membership. There are also a membership that is concentrating in WASH approach. And there is also membership that focusing on mother and children health movement. And there is also local CSO that do not having specialty in nutrition. They're doing advocacy or technical assistance in many area or cross area. Next slide, please, Andy. Yeah, we have done some nutrition can wheat campaign as encouraged by Sun CSA Asia. We conduct a joint statement on food nutrition security during COVID-19 pandemic. GSO membership expansion workshop in Central and East Java, also using the hashtag of Nutrition Can Wait campaign. We also doing good practice sharing in Central Java. Now we just starting the nutrition planning and budget analysis in Central Java. We will do this in another province in at least 2 provinces in Indonesia as well next coming months. Asia Sun CSA also sharing adolescent nutrition webinars during and beyond COVID-19 pandemic. This is the cooperation between Indonesia Sun CSA and Pakistan Sun CSA and Asia Coordination Group in conducting this webinar. Some of you might already join this webinar about 2 or 3 weeks ago. There are also several trainings meeting we already conduct, like breastfeeding code meetings, stunting reduction program. We also support non-health sector to ensure nutrition and health services in COVID pandemic. We also impact of COVID-19 towards state of nutrition and program in Indonesia. We are still facing a challenge like other country. COVID pandemic is still going now. The rate is also increasing in Indonesia. Maybe some other country already stable, but Indonesia day by day, the number of infected cases is increasing. Next slide, please. Okay, this is the one success story that we want to introduce or share to other Sun CSA country. This is pictures of 2 Ministry of Planning Agency, which is Sun CSO focal point, and Ministry of Health, which we successfully changed the standard of wheat flour fortification. In the previous standard, the fortificant we use the fortificant that is less bioavailable, so there is no significant impact in reducing anemia. This wheat flour fortification objective is to reduce anemia which is very high in Indonesia. Now the standard already following WHO standard. We are using more bioavailable fortificant, iron fortificant. We expect in the next coming years the anemia rate in Indonesia will be reduced. Next slide. This is the last slide. Our challenge is still about COVID-19. Maybe the same with other countries. There are many essential nutrition services cannot conducted as a normal situations. There has already been shift in priority from nutrition issue as the government and donor focus towards COVID-19 response. Some budget on nutrition are reallocated to COVID-19 responded. So this is issue being faced by Indonesian country. And COVID-19 also expected to have a severe impacts on nutrition program. It will be essential to consider integration of good nutrition practice in COVID-19 response plans. So we are trying to insert the messages of the importance of nutrition in any COVID-19 response program. Most project activities are currently during the pandemic lockdown, which has caused delay in program implementation. I think that's all, Andy, from Indonesia. We are very happy if there is a question on discussion on this presentation. Over to you, Andy.
Fantastic. Thank you, Rosie. That's really, really great to hear. And yeah, absolutely, really wonderful to hear all the amazing work that you've been doing, and the kind of the expanding into the district level sounds really exciting. And the great work you've been doing with the other Sun networks within country. I think that's a really great example of cross collaboration between the networks. Again, I think that your success that you've shown of the wheat flour fortification is incredible, and I think that's one that we can really really replicate in other CSAs, and I know that many other CSAs would be keen to learn more about that, because I think it's a huge win, especially what you've been able to achieve with that in Indonesia. So I think that's a really great example that we can use. And again, relating to your challenges as well, you know, the COVID and the subsequent lockdowns that are with that have certainly been a challenge. And I think for all of us, you know, we can all relate to that. And I know I think in Asia, maybe you're doing a bit better than we are in Europe at the moment. We're going through our second wave, so we're just heading into another lockdown. So those challenges really are affecting us all. And really, I think for Indonesia, the amazing work you've done, despite the challenges, have been incredible. So yeah, really great to hear. So what I'll do is I'll just open it up to the floor. So if anybody has any questions or any thoughts or any feedback, yeah, please do share. We've got about a couple of minutes to share any questions or thoughts for Rosie. Please do just speak out or raise your hand, whichever works best for you, or put it into the chat box if that's easy as well.
Hi, I'm from the Philippines, and I'd like to ask a question.
Yeah, of course. Go ahead.
That was really impressive on what you did with the food fortification, and to think that it's guidelines that you were able to influence. I just realized that since Sun CSA Indonesia was just started last 2019, how long did it take you to actually contribute and create a change in terms of policy? Because in the Philippines, there is difficulty implementing change and effect, especially those related to plans and policies, due to bureaucracy and process in the government. Thank you.
Okay, can I directly respond, Andy, or wait to
Yeah.
another question?
No, absolutely.
Okay.
Yeah, respond.
Yeah. Thank you, colleagues from Philippines. I also have visited some wheat flour plant in Philippines. I did about 3 years ago. So if you ask, yes, we just established our CSO Civil Society Alliance last year. Actually, it is not established but reactivated because in the previous year there already Sun CSA, so Civil Society Alliance, but it is not active. So when we appointed by the government in 2018, by the end of 2018, in 2019 we tried to reactivate the Sun CSA, and it was just in April it is formally launched. But talking about this fortification, it is not the 1 year effort. It already for us it already take 4 years. So in the previous standard, we are using if you aware about the fortificant, we are using elemental or electrolyte island, which is less bioavailable, which is do not have impact on anemia reduction. While in our country, anemia is becoming high and high again, the prevalence. And last national survey indicating that anemia in pregnant mothers increased from 37% to 49%. This is a very critical situation. It is because also the food, the wheat flour that we fortified earlier is not having impact on this anemia. We is trying to advocate the government since 2016, doing advocacy, provide technical assistance, conduct an organoleptic study, also establishing the enabling environment. So it takes about 3 years to change the standard. Thanks God, last year the national standard already changed. We are following the WHO standard. We are using now more bioavailable iron like ferrous fumarate, ferrous sulfate, or sodium ADTA. But now we still waiting the mandatory regulation on this wheat flour fortification. I do hope that Philippine CSO and other colleagues in Philippines can follow also. I don't know whether now fortification of wheat flour is mandatory or not in Philippines. But the first thing you have to do is to make it mandatory in the future. Back to you, Andy.
Fantastic. Thank you. That's really, really great and really exciting to hear.
Yes, hello,
really great. Yeah, Nazneen, absolutely. Go ahead.
Thank you, Andy. And this is really excellent and amazing activities they have done within this short period. I have 2 points. One is regarding this fortification of flour. Any fortification for food is increase its cost. So my concern is what if its cost increased? It is available to our lower socioeconomical, the people who are living in lower socioeconomic status. So this is I just want to know from your side. And also you mentioned that during COVID situation you have developed a joint statement. This is really interesting because in Bangladesh, what is the real practices, UN network with government, they usually develop a joint statement. So from CSA, we trying to develop a position paper or share talking paper to circulate within our community, general committee members and others. So I just want to learn more from your joint statement. Is it possible to share with us? Thank you.
Okay, thank you for your question. Actually, wheat flour fortification is very cost effective. It is very small additional cost for the supplier. The issue is we have to make it mandatory, not a voluntary. If we make it a voluntary, it is very difficult to gain a successful, because the cost will be transferred from the supply producer to the people. And government could also, if some producer thinks it is expensive, government can provide subsidy. If you need some document on this wheat flour effectiveness, we can share with you after this workshop. And secondly, about the joint statement, yes, like you also, there is also joint statement between the donor and UN agency. But in Indonesia, we among the CSO itself do our own statement. We have an agreement with our own because sometimes our interest is quite a little bit different with this UN agency and donors. Sometimes a member of CSO more having focus on grassroots activity, service delivery, health service delivery at grassroots. So we gather together, having our own joint statement. Then we invite the Sun focal point to engage in launching this joint statement. So it is also good for us. If you need it, we also can share our joint statement with you later on. Over to you, Andy.
Thank you. Thank you very much.
Yeah.
This is helpful.
Fantastic. Thank you so much, everybody. So what we'll do now is we'll move on to the next presentation. Vietnam, I think that's going to be over to you. Would you like to share the screen, or would you like me to share the screen for you?
Hi, Andy. We can share from our screen.
Perfect. Fantastic. That's really great.
Can you see our screen?
Yes, I think it's just coming up now. Wonderful. Yes, can see it.
Okay. Hi, Andy, and hi, everyone. On behalf of Sun CSA Vietnam, we would like to share with you brief information about our Sun CSA Vietnam in 2020. And it's the first picture for when we launched our Sun CSA last year in 2019. Next, please. Sorry, for some technical issue, we cannot move to the next slide. Can you wait for a moment, please? Em xem cái connection, cái chat này sau lưng mình tí. Sorry for.
That's okay. I mean, we can see it still.
No, but we want to move to the next slide, but it doesn't move. Sorry for that. For some technical issues, so please wait for a moment, please. Sorry, it's technical problem.
It's okay. Yeah, no, I
How about Andy share his screen?
Perfect. We have 13 members, including international organizations as well as the NGOs. And for a year, we have recruit some more local NGOs to join with us, such as LIFE, CPU, CCHS, and FIDR is just recently joined with us, is the international NGO. And we registered under NGO Resource Center, and it's kind of, I don't know how to explain, but it is kind of PACOM and NGO Resource Center to managing NGO, international NGO in Vietnam. And we have several children as the chair, and then Health Bridge as co-chair. And we also have a core group including 8 members. We don't have the sub-national group yet. We still have no fan page yet. And so we're very excited to learn that Indonesia is just established, and then you have a fan page already. And for us, we are planning to set up the fan page soon. Next, please. Yes, and for the achievement, one thing we're very proud of that Sun CSA Vietnam support for the government, to contribute for the government to including the nutrition, the first 1,000 days into the national targeted program for ethnic minority area. And then Vietnam set about $6 billion to support the socio-economic development for the ethnic minority, including maternal and child nutrition. And
sorry, the screen is not moved to next slide.
Oh, sorry, the screen is not moved. We already moved to another screen. Sorry.
Yeah. I'm just looking at it now. It looks like we're still stuck on the previous screen, but I think it's just about to move to slide 3.
Sorry. So can you help to share screen from your side, Andy?
Yeah, I'm happy to do that. Would you like me to do that?
Yeah, sure. Please help to do so.
Yeah, no worries.
Oh, sorry for technical problem.
No, of course, honestly, it happens to us all. I'll just get your slides up now. 1 second.
Thanks, Andy.
Okay, so can you see that okay?
Yes, we can see that. Thank Andy.
Fantastic. Let me just skip to your slides. We were on this slide here, right?
Yes, exactly, Andy.
Fantastic.
Yes, and then we send we have a meeting with the National Assembly member, and we also working with different organizations like other organizations like World Bank, WHO, and etc. to advocate to including the nutrition for first 1,000 day practice for ethnic minority and for high stunting prevalent communities in ethnic minorities. And what we contributed is the first thing that we provide technical assistance to National Assembly, Ministry of Health, from the concept note to program intervention, design, and monitoring. And secondly, we participated in several drafting meetings with the oversight board member to advocate for that. And then that program successfully approved by National Assembly. Thank you. Next, please. And the second achievement that SunCSA Vietnam have successfully in the 2020 is that we enhance regulation on the workplace lactation from the voluntary to compulsory among the employer with more than 1,000 female employees. And because the current degree for guiding labor code is only requesting the employee have encourage the employee have a workplace lactation room. But we are with the support, great support from ANT, we have successfully advocate to put the compulsory workplace lactation room in the draft degree. So it could benefit for like more than 2.5 million female workers in Vietnam. And what have the SunCSA Vietnam contributed? The first thing, we provide technical assistance to the board of policy maker. And the second thing, we invited to provide expert comment on several consultation workshops. And we also involve UNICEF, UN Women, IO, GIZ, CARE, and other organizations in this advocacy. Next, please. And for the campaigns on nutrition conduit, we have the report, SunCSA Vietnam report illegal BMS promotion by different companies during COVID-19 in Vietnam. And secondly, we also cooperate with the Child Rights Working Group to conduct a rapid assessment on the impact of COVID-19 on children and maternal. And here's some picture. One on the right-hand side. It is our letter to the Ministry of Health for reporting the illegal BMS. Next, please. And for the story, successful story for 2020, like we already shared, that is our proud to say that we advocate successfully for the nutrition in the national targeted program for ethnic minority development from 2021 to 2025 with about $6 billion for the ethnic minority area. And we in that program, we're setting for the stunting target from 15% by 2025. So now we are working with the Ministry of Health to have a more detailed development for that program, and then have support the Ministry of Health to set up the monitoring and evaluation framework to monitoring the successful of the program and to enforcement that. And I think it is the last slide. Yes, yes. Here from here. Next slide for the picture, the final picture. Yes, here's some pictures from some picture from ethnic minorities area from the different NGOs. We show that in some case for the I can see it is the picture from a meeting with the National Assembly on the right hand side, and on the left hand side is some photos for the children and mother in the ethnic minorities. So here is some information from San CSA Vietnam, and then college here if you want to add more information, please feel free. Thank you everyone. And
yeah, looks like you have one more slide.
Yeah, sorry. Sorry, it's a challenge. Of course, it's like other San CSA, we're also facing the problem for fundraising. But we also have some another challenges is that to get the consensus among San CSA members for long-term strategy, and then we also have problem with scaling up in multi-stakeholder environment, because I think it is also some challenges for other CSO as well, for the San CSA as well. And we also have some solution already discussed. The first one is we have agreed on clear working mechanism among our members, and then we also have to finalize our advocacy strategy in our meeting, our annual meeting in this December, planning this December, and we enhance the engagement with the government agencies and business sector, as well as expand our network to more to involve more local NGOs to join with us at the national as well as the sub-national level. Thank you. So finally, it is the end, the last line from us. So sorry.
No, of course, absolutely not a problem. That's wonderful, and really, really just great to hear the amazing work you've been able to do in such a short period of time. You know, really showcasing from October 2019, which wasn't that long ago. You know, it was only a year ago, and the real amazing work you've been able to do in that space of time, and with all things considered as well, with COVID challenges that we've had this year, I think really inspirational, really inspirational. And yeah, I really like to see. I really like seeing the kind of growth that you've been able to do in this short pace of time. A really great template, really, to showcase how a CSA can grow. I think it was really lovely to hear about the work that you've been doing for ethnic minorities, and which including the maternal and child nutrition. I think that's a really great kind of showcase of important and vital work that for kind of vulnerable communities. So I think as well the workplace lactation rooms, I know that's a huge one that many African CSAs are also trying to do. So I think your huge success with that. I mean, the fact that potentially 2.5 million female workers could be reached through this is incredible. That's a huge amount of people that could be benefit from such a fantastic initiative. So I think this is a great example of the amazing work that you've been taking part of. I think the BMS codes that you discussed, the violators, specifically during COVID, we've seen that quite a bit across the whole global network, and I think that's the fact that you were identifying and conducting those rapid assessments has been great, and really showcasing how we're able to challenge the BMS code violators especially during a time of a crisis. So yeah, and I think your challenges certainly speak to many other CSAs that certainly faced in terms of fundraising and getting that consensus among the members as well. Those things are challenging, and also with the multi-stakeholder platform as well. Scaling up that is certainly a challenge, and we see many times that the civil society tends to be the network that leads the scaling up of the MSP. So we're really keen to support you as well on that. I think going forward, because they are big challenges, absolutely. But it sounds like you have some really great solutions as well. So what I'll do now is I'll open it up to the floor to see if anybody else has any questions or any thoughts. I think there's a couple of questions coming in the chat box. Let's have a look. Camille, I think, from the Philippines, I think you had a question there.
I was just curious how widespread was the involvement of the Sun CSA in the rapid nutrition assessment?
Yes, for the rapid assessment, because we joined with the Tri-Wide Working Group, it is alliance for quite long, how can I say, it is a big alliance. They conduct the assessment for the general, how the COVID affect to the child rights in Vietnam, and then we take that chance to take the assessment in terms of nutrition, and we involve all the people, all the members from Child Rights Working Group to join with us for that, and then some members from Child Rights Working Group, they also the member for our Sun CSA Vietnam, and then we conduct in 28 provinces in Vietnam.
Fantastic, thank you. Open to the floor. Any other questions or thoughts or any feedback based on an incredible presentation from Vietnam? Rosie, yes, over to you.
I have a question, Andy. Yeah, first is about the violation of breast milk breastfeeding conduct. Yeah, I have a question because in Indonesia we also have this issue. Yeah, the question is whether Vietnam's already have an agreement of the code of conduct on this issue. In Indonesia, the situation we still don't have agreement between all the stakeholders, including the government, on code of conduct of this breast milk violation, breast milk substitution violation. So it is a little bit difficult for the Sun CSO to push the government to enforce this situation. This is first question. The second question is about you mentioned about the challenge on fundraising. It's also question maybe Andy for global Sun CSO. You ever mentioned that the global Sun CSO also have some tools for the CSO sustainability in the future. It is not about the fundraising, but how to recapitulate efforts to make the Sun CSO or Sun CSA sustainable in the future.
So maybe in terms of the question regarding to the violation of BMS, I would like to invite ANT can have respond for that.
Yes, so you may know that in Vietnam we have a government decree to regulate marketing and promotion of breast milk substitute and also bottle and pacifier. However, the government decree doesn't include very clear guidance on conflict of interest about whether the government agency can receive the support from companies for the activity in general. So the government banned all the support from the company to promote the breast milk substitute, but for some other activity like to support, for example, a workshop on a general health is not very clearly defined. So conflict of interest is an issue. The Sun CSA Vietnam in the past year is very active to engage with Ministry of Health in order to monitor the violation and also to have a training on the BMS code for all the Sun CSA members. We also propose a mechanism to work with Ministry of Health to enhance the monitoring and also the enforcement that the Sun CSA may play a bigger role to support the government for monitoring. So we are working on that, and hopefully in the next year we will have a better coordination mechanism with the government agencies. So that's all from Vietnam.
And also, just very recently, one of the company who violate the BMS just approaching us for offering funding to working on obesity prevention.
Thank you.
The second question, Andy, is I think is for you about the sustainability strategy for the Sun CSA in general.
Yeah, absolutely. So really great question, Rosie. I think that the sustainability and the fundraising are two really important parts that we certainly, every CSA certainly has this challenge at some point. And I think that what we are trying to do from a global level is to make sure that the pooled fund, which is a key part of funding, is continually utilized for civil society alliances. And that's we're really kind of, it's the different networks each have their kind of viewpoint on how the pooled fund should be spent. So we've been quite successful so far in making sure that we have that space from the pooled fund and that funding from there carved out for civil society alliances. But also going forward, we have a couple of initiatives that we're working on and hopefully in the pipeline that we're keen to really help CSAs in terms of their sustainability in the funding. So there's a few different ideas that we're working with donors on, such as sustainable income grants. So these are kind of long-term grants that will help CSAs cover the basic costs and cover those kind of basic needs. And then from that, with the requirement to reach out to donors and get more funding for the additional work. So there's kind of things like that are in play that we're working on. The regionalization as well. So we're looking at how we can utilize our regional work and our regional groups, as the Asia regional group is a wonderful group. So we're trying to see how we can strengthen that through funding, but also if there is elements, and I think there is, it's just getting some more donors on board, how we can do kind of regional approaches to fundraising. So, is there donors that the donors that we know working within, for example, the Asia region, how can we bring them together to do a regional approach to their funding and their granting? So can we have, the CSAs across this region to be provided with grants from a Asia regional perspective? And we think this kind of ties quite well in with the campaign that we ran, the Nutrition Can't Wait campaign, and things like that, that really see a region come together. So that is one way that another way that we're kind of trying to figure it out for that funding and sustainability. We have various tools as well. So we have the tools and templates that are available on the Sun CSN website. And of course, myself here as well. I'm hoping as well that through this and through the Sun 3.0 in particular, we have a stronger Sun donor network. And we really want to help the donor network from the global perspective to support the in-country donor networks, to really reach out and work with the civil society alliances to support them directly at country level. So it's an area of work that we're working on. The Sun Donor Network is a lot smaller team at the global level, so their capacity is quite stretched, but it's certainly something that we're trying to encourage, kind of that better support from the donor network in country for their civil society colleagues in the network. And I think that that's a really important point, and I think that will help us have that sustainability because it can have that country to country support. So yeah, we're hoping that there's a few different initiatives like that we can help with sustainability. Again, there's myself here as well to help all the time for any fundraising needs or any applications and proposals. We're hoping to get some more opportunities out to you as well at the start of next year. This year had kind of fallen off a bit, so we're hoping that we can get the monthly emails with opportunities back to CSAs for 2021 as well. Hopefully that answers that question. Yeah, any other?
Thank you. Andy.
Yeah, no worries, Rosie. Is any other questions or any other thoughts as well? Okay, no worries. So I'm just going to check here. I think we also have a presentation from Nepal listed down, but I'm not sure that we have the presentation from them. So let me just double check that. But if there is any other questions or any other thoughts on the Vietnam or Indonesian presentations, please do share them as well. Very happy to kind of have them discussed as well. Camille, I see you had a question. You've added a question in there.
Or Andy, I have question for the question regarding sustainability.
Yeah.
Are there any effort from Sun Global to enhance capacity of Sun CSA in Asia, providing training, providing workshop for this kind of sustainability effort? Because you mentioned there is a tool that developed by Sun Global, Sun CSO Global.
Yeah, absolutely. That's a really great question. So we do have the toolkit on the website, absolutely. But I think that the training and workshops are going to be another key part of how we can do this. So the plan was this year, hopefully, to have more fundraising training and more kind of initiatives and workshops for CSAs. Obviously, COVID has kind of affected that quite greatly. We have in terms of being in person, so we're hoping that next year we can maybe have some more in-person sessions when post-COVID, but also some online sessions as well. We have there's myself, but we also have a couple of contractors that we work with that are consultants in fundraising. There's a really great one who is based in Japan actually and works a lot with some of the Asia region. So we're keen to utilize his expertise, and he has lots of trainings and workshops that he can do. I'm always keen to hear from CSAs to reach out to me directly and say, I'm keen on if you're interested in any training or workshops and things in particular, then please do let me know, and I can always attach with a consultant. But I also think that my plan is hopefully for next year to utilize the fantastic consultant we have that's based in the Asia region who really focuses a lot on the fundraising and that kind of country level fundraising as well. He's really great at understanding the global context, but also those in country specific context in terms of domestic resource mobilization. So really bringing funds from the national level and bringing them together.
Okay, thank you.
No worries. So we have around 10 minutes left before we head back into the main plenary. So yeah, if you have any other questions or any other thoughts, do just let me know, and we can just discuss. And then I will feed back when we go into the main plenary as well, kind of any other point. There's some key top line things we discussed, and any other points. So yeah, please do share any questions you might have before we head back. And just to flag that hopefully you've all seen as well in the chat box, Denise has shared the plenary link. So when we go back, if you just click that link, it should take you back to the main plenary hall room, and this one should be on hold, and we can leave this room. Nazneen, yes,
Thank you, Andy. Thank you.
No worries.
Yeah.
If there's no other questions or any thoughts, I think what we can do is we can maybe start to head back to the plenary room. I'm definitely happy for you. Yeah, certainly go and get a coffee break or a tea break or bathroom break, whatever you might need. Feel free to do that. We should be starting back in the plenary room around 10:45. So sorry, 10:45 GMT UK time. So within the next 10 minutes. So please do take a break, have a drink, get a drink, and then we can meet back in the plenary room. The link is there, so once you press that, it should hopefully take you back to the plenary. Again, and thank you, Indonesia and Vietnam, for wonderful and incredible, inspiring presentations. Really great.
Thank you all.